that there was an old slogan in the Clairol ads that went, "Only your hairdresser should know for sure." And how does that relate to plastic surgery? And it really raises the question as to whether plastic surgery in its ideal form is something which screams from across the auditorium or stage, or whether it is more subtle, and in fact the work of the plastic surgeon can't be seen, but the patient looks fantastic. Now, I can't lie. There are too many instances, and watching television, particularly reality television, where I find myself staring at the screen at blatantly what I call extreme plastic surgery, where the plastic surgery is written all over a patient's face or their body, and their body is exaggerated and totally out of balance, and missing the harmony that I would ideally like to see. And I can't lie, I look at these patients and I think to myself, do they like what they see in the mirror? Does that make them happy? And I honestly don't know the answer to that question. Whether it's a philosophical difference between different plastic surgeons. There's some very successful plastic surgeons who their work is very extreme and it's very easy to spot. And I think that there are other plastic surgeons that you have no idea that it's there. And in fact, I somewhat regret the fact that the very obvious plastic surgery is what we see, and the subtle, what I consider elegant, idealized in my mind, plastic surgery is not so noticeable. So you see where I am on this. It's pretty clear. I think our work should enhance, but I do not feel that we should be putting faces out of harmony. And I do not feel that we should be totally redefining what an aesthetic face is. You know, over-exaggerated lips always the easy one that comes to mind. The second that comes to mind is where patients have these super tight necks and their heads sit there like one of those bobble dolls. You know, that doesn't work for me, and I'm very upfront with it, and when my patients come in to see me, I'm very upfront with them. I can't pretend that I want to do that. And I'm very clear that if that's what they're looking for, then I'm really not the right person to be doing their surgery, because I don't consider that aesthetic. So I don't have an answer. I find it fascinating. You know, perhaps in parts of our society, certainly we can name Los Angeles, Texas, and Miami, where over-exaggerated breasts are in hot demand. And one could have a philosophical discussion about why that is as well. In the Northeast, breasts tend to be much smaller by a significant amount. And so there are cultural differences there which exist. And that's pretty clear. Again, I think it comes down to communication and choosing your plastic surgeon. I do find looking around that certain groups in certain actual geographical areas tend to keep going to the same surgeons, and there is a similarity to what their friends at the club have or their neighbors have. And again, I can't help but ask the question, well, do they like that, or is that just that that's what everybody does and so they continue to do it? I don't have the answer to that question. I find it rather fascinating, and I think I find it particularly fascinating as a female, because I find that an awful lot of the facial cosmetic surgeons tend to be male. And it's interesting, it's almost like sometimes I wonder if it's a Pygmalion response that women go to males to have this done, and maybe they need that affirmation. I'm honestly not sure. It's a puzzlement to me. I think it's a really interesting question. But my feelings aside, I think from a patient standpoint, that whoever they choose, it should segue closely with what their desires are. And I will confess that in my own practice, I have an awful lot of women who have come to me and they want facial cosmetic surgery, But their biggest concern is they don't want to look like a freak, and they don't want to look over-exaggerated. And so part of my consultations tends to be, no, I'm not going to do that to you. That's not my aesthetic. So the communication and making sure that you're getting what you want is always at the heart of all of this. And I would certainly encourage any patient having any type of surgery to explore that carefully.